Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, February 9th, giving you the update from Albany Med. All right, Fred, we'll throw up the first graph here. This is Capital Region, the 8 counties. We currently have 326 in the hospital.
Yep.
That was as high as 553.
A very significant drop-off when you look at that curve.
Absolutely.
It's really good.
Next graph is Albany Medical Center specific admissions and discharges here. And we show this one really primarily to point out a couple things. The first is that we really very rarely now are having days where we have 10 or more admissions. So that certainly is encouraging. Right. And again, we have to mention at least once a week that there's no influenza activity.
That's right.
All right, very good. Then next graph here is the morning census here at the medical center. So 102, 22 in the ICU, 10 on ventilators. I think one of those 102 are under the age of 18. Now, last week we made a prediction. We said we'd be under 100. We actually did slip under 100 for a little bit, pop back up, but probably by Thursday back under again.
It's the early part of the week, Dennis, and we tend to accumulate and not discharge over the weekend, so I think that's what we're seeing.
So all moving in the right direction.
Absolutely.
Speaking of moving in the right direction, when you look at the prevalence rate in the community, so this is measured by the total number of people tested, how many test positive,
yes,
and then they do what's called a 7-day rolling average, really kind of just to flatten it out and make sure you get a real average. We're at 3.4%. Now the state average is 4.4%, so we're under the state average, which is good news, but also this was a trigger point for several different counties to say they will now allow high school sports to start again.
That's right, and we heard last night Albany County is opening up sports.
Right, so certain sports that were considered high risk are now
hockey, basketball,
football,
yep.
Right. So Fred, this brings open the conversation about whether or not if you've had COVID, if you're say a high school student or an athlete, you know, what the proper time frame is before you're allowed to play. And you have an article you'd like to talk about.
That's right, Dennis. This was actually on my listserv yesterday. It's from JAMA Cardiology this month. And it's a group, writing group from multiple institutions, Emory, Mass General, from across the country. And they're trying to give some guidance on a student athlete who has COVID. When can they get back to exercise? When can they get back to competitive sports? So they're very transparent. There isn't a lot of data, certainly no controlled studies, but they're using their expert opinion and what little data there is out there. So when it comes to high school students, if you're under 15 or over 15, a little bit different. If you're under 15, if you've had asymptomatic COVID or even mildly symptomatic COVID, 10 days after you've been diagnosed, you can get back to exercise and playing sports.
So you don't need any type of test to clear you?
No. Now, some schools in the area are going to require that you get a note from your doctor. That you be seen by your pediatrician and cleared. But you don't need anything more than that. In the over 15 age group, they also talk about those two categories, but then they also talk about moderate and severe illness, which is more likely in that population. So the same thing applies in the asymptomatic and the mildly symptomatic. 10 days after your diagnosis, or if you're symptomatic, 10 days after your symptoms start, you can gradually start exercising and getting back into things. If you've had moderate symptoms, so think you're really kind of sick with a fever and all the symptoms go along with this, or if you've been hospitalized, and that's the definition of severe, then you probably need an evaluation before you go back to any kind of competitive sports. And that evaluation starts with your pediatrician and perhaps even goes to a cardiologist for testing to see if you've had any damage to your heart. Very unlikely, but something that needs to be thought about and cared for.
So it sounds like a great article. We know Enid Geyer and her team will put it on the Schaefer Library site, which is wonderful. So people can read it. It's a longer article.
And it's got algorithms. So if you look at the algorithms, it tells you what to do with the different symptomatic circumstances, et cetera.
So the good news is we know that we've had a relatively small number of children or teenagers who've actually had to be admitted to the hospital.
That's right.
So the majority of those who fall into that age group who have tested positive are probably in that mild group.
Or even asymptomatic,
asymptomatic.
because some of the schools are actually doing
Right.
surveillance testing.
Right, so good. So great information, Fred, and very timely as well. The last topic we want to talk about is N95 masks. Now, as we know, these are masks that members of our workforce wear in particular clinical situations, not all the time, but certainly in certain types of situations to protect against a particular type of size of pathogen that might need to get
very
to that
small
mask.
ones.
Very small ones, right. And we sent out a messenger about this recently where there was a recall of the teal ones. So let's break this down, Fred. There are three different types of N95 masks that we use in the hospital. There's teal, the color teal. There's white, and then there's what we call orange duckbill. The first question is there any difference as far as the safety or the efficacy of those three different types?
No, Dennis. They all have the same ability to filter out those very, very small particles.
All right.
So they're all as safe as the other.
They all work the same. Now, I know historically people have often thought of the teal as the go-to mask because that's what a lot of us wore and still wear.
It's what we used to use before all of this happened. Yes.
So they say, an N95 must be teal, but in point of fact, the white or the duckbill work just the same.
And Dennis, as we go through this recall, the teal masks are going to be harder and harder for us to get. So we're really going to have to pivot to the white and the duckbill masks.
So let's talk about the recall. We learned that there were 2 lot numbers of the teal ones that had to be recalled.
That's right.
And so obviously what we want to be sure is that an individual who wears an N95 mask is fit tested for the proper mask. Now, they're not translatable. You have to be fit tested for each one of them. So if you wear a teal and you've been fit tested for that, you actually have to be fit tested for the white and for the orange duckbill.
That's because they have slightly different shapes, and so we have to make sure they fit on your face properly.
So if you wear a medium in one, you can't automatically assume I wear a medium in the other.
That's right.
So with the recall of the many of the teal ones, we are now saying to our workforce, we need to be sure that you are fit tested for the other ones as well.
That's right.
Let's break it down. If you work in the operating room or labor and delivery, we are encouraging them to go with the orange duckbill.
That's right, Dennis. The duckbill are water resistant, and in those circumstances there can be splashes, so it's important that they have a water resistant mask.
So if you're somebody who works in the OR or labor and delivery and you've been fit tested for the teal, you now need to go down and get fit tested for the orange duckbill.
Correct.
If you work in areas other than the OR or labor and delivery, we say start with the white, get fit tested, and if you don't pass that test, get fit tested for the orange duckbill.
That's right.
And then finally, if you don't pass either one of those tests, you would then have to wear a PAPR.
That's right.
But you couldn't wear the PAPR.
You can in the OR.
In the OR,
right, because it pushes air out. Dennis, in terms of our supply, we have more than 6 months worth of both the duckbill and the white masks.
Excellent.
In all the different sizes. So we have plenty of masks that will do what we need for those staff that are working with COVID patients or aerosolizing procedures where the N95 is important.
But Fred, you said something really important before, which is that we have no assurance that a month, 2 months, 3 months from now we'll have the teal, right? Because recalls and other things.
Right.
So we want to be sure that our workforce is safe and that they're fit tested for other types of masks that we know we currently have on hand.
Exactly right, Dennis.
So let's go over the information, Fred. I believe the fit testing is occurring in Choices Cafe.
That's right.
And that's Kenny Urquhart and his team.
Kenny Urquhart and his team, yep.
Doing a great job.
Shout out to them.
So 2 weeks, starting today through the 22nd of February. And you can go from 7 a.m. to noon, and then you can go from 1 p. to 5 p. And I think there's a scheduling system that people use.
That's right. And so this has all gone out in the messenger for people to see and to actually sign on and schedule. They're 15-minute appointments, I think, so there's enough time. It's very important that if you use an N95 mask and have only been fit for the teal mask, that you sign up and get fit for one of the other 2 masks.
Any questions, talk to your manager. I'm sure they'll be able to give you some more information as well.
Absolutely.
And no eating or drinking or smoking before the test as well for 15 minutes. All right, very good. I'm glad we got that information out. It's very important. That's it this week, or actually that's it today.
Today. We'll be back on Thursday.
We will be back on Thursday. All right, very good. We'll see you in 2 days. We ask that you once again take care of yourself, take care of each other, and we'll see you on Thursday.